Hello, Nick here. We are continuing our clinical A to Z. We are on C, Calcaneal Apophysitis. Commonly gets the term Sever. Calcaneal Apophysitis is just slightly more correct. So, what is it? Believe it or not, this is a heel bone, ankle bone, and an Achilles tendon. Apologies for the drawing. This only occurs in children. The reason being is we need a growth plate, and we have the growth plate around the back of the heel here. And effectively what's happened, the Achilles tendon is pulling on that growth plate, and it's what's causing the symptoms. So we typically tend to see this in boys and girls 11 upwards, and what we'll tend to find is there's been a sudden change in activities. So, going on to now, what causes it? Growing. We know that after growth spurts, this is when you're maybe slightly more susceptible to having some pain around this Achilles heel region. A lot of exercise or a sudden change in exercise. So coming back to school after the summer break, you've had some nice couple of holidays away, relax, you're back to school, PE, after school club, football, it's all started up again. So you've had that big increase in exercise and activity, and again, that tends to flare things up, especially things like football where you're playing a completely flat boot. So again, it's always back to school. In my mind, we should try and be grading exercise and activities when we get back to school. But the good news is most people get better on their own over time. By the age of 15, symptoms tend to settle. But we can't turn around and say, you're an 11-year-old suffering with some problems, we're going to leave you for 4 years, you'll get better on your own, but you've got to suffer in the meantime. Nah, there are things we can do in the meantime. But also, pain is not bad. And what I mean by that is, if you've got pain and symptoms, don't worry, you're not causing any long-term damage. But what can you do about it? Education is the big one. So it's educating about what it is, when to look out for it, when you most likely be susceptible to it, and what to do about it. Because a lot of this you can actually start managing yourself. So things you can look at doing. Heel raises. So popping a heel raise into the shoe, rising the foot up slightly, can make life feel a little more comfortable. Calf strengthening exercises. So doing some heel raises off the other step can make life more comfortable. Flexibility. People always harp on about flexibility work and calf stretching, and you must do calf stretching. Well, you only need to stretch your calf if they're tight. If they're not, don't worry about it. Insoles. People always talk about you need insoles. No, you don't. The majority of people is you manage the education, you manage the load, you get a little bit stronger, and a heel raise tends to work for the majority of people. Then if it's not, then you move on to insoles, but the majority of people don't need them. There we go, Calcaneal Apophysitis, and we shall see you on the letter D.